Hello, I'm Bia Carlini, and the main instructor of our course on tobacco health-related disparities. I also am associate professor at the School of Public Health, Health Service Department, and a research scientist in Alcohol and Drug Abuse Institute. We'll be talking today about the tobacco epidemic in the United States. It's really the background of our discussions in the next modules are going to take place. I would like to start by bringing your attention and to welcoming the partnership we made for this course and some specific modules, including this one, with Northwest Addiction Technology Transfer Center. The website is below, and I really invite you to learn more about this organization. It serves 4 states in the country, in the northwest of the country. It's located here at UW and seeks to accelerate implementation of evidence-based practice for treatment and recovery of addiction. So it's an honor to be partnering with them, and I would like you students to consider clicking on the inbox, in your inbox email, on message that is going to have a link to answer very few questions about the services, and particularly this lecture is anonymous, and it helps a lot on the development of the work that Northwest ATTC does. We are going to be dividing our time today on talking about topics of cigarette epidemic, disparities, and emerging products. I would like to start with a background where we'll have the chance to define 3 things. The first is when we really talk about tobacco epidemic, we are talking here about the commercial tobacco. This is really important in terms of not honoring the fact that many native nations in this country have used tobacco for many, many centuries and cultivated tobacco with the purpose of traditional healing. And many indigenous people to this day still uses tobacco for praying, thanking the Creator, communicating with the spirits, purifying mind, and heal the body. Tobacco is part of one of the sacred plants, traditional plants for native nations, as sweetgrass, cedar, and sage. So we are talking about commercial tobacco, and we are also clearly distinguishing between nicotine and tobacco. This is very important, and a lot of confusion from a lot of assignments come from not understanding this very important difference. Nicotine is a very addictive substance. It's more addictive than heroin. That being said, it's a relatively safe drug. What really causes death is tobacco, and the tobacco use is today the #1 cause of preventable death in the US. So I'm getting a quotation here from FDA, is the mix of chemicals, non-nicotine, that causes serious disease and deaths in tobacco users, including fatal lung diseases like COPD and cancer. So let's keep that in mind to better understand when we are talking, for instance, about FDA-approved medications for quitting tobacco, like nicotine replacement therapy. You are replacing the very addictive substance that comes in tobacco and kills you. Or when we are talking about vaping and all the discussion around vaping, it's something to help you quit or just to addict more people. So there is this issue about delivering nicotine in the tobacco plant or not. So this is the second background that I'd like we all to be aware when we go through this module in the course in general. The other is that although we are talking here about tobacco products like cigarettes and e-cigarettes, this is going to be the main focus of this course. We recognize there are many other products that are available in the market for non-medical purposes, and they are important as well. I would invite you to maybe consider focusing one of these other substances for your term paper so you expand your knowledge. So that being said, let's talk about the cigarette epidemic. And again, we are talking about cigarette specific at this point. Uh, I'm not sure this is really news to anybody. We know that although we have right now about 14% of all adults smoking, which is 34 million. This is less than it was in the past, but still we keep about 500,000 deaths that can be attributed to cigarette smoking every year in this country. The trick is that it's easy to forget they are from cigarette smoking because the cause of death is mostly other diseases, not behaviors or addiction. So lung cancer, COPD, heart disease are the main ones, and but they are directly attributable. A big percent of these diseases to the fact that they come from smokers is a death way before its time, and it's caused by tobacco. How that happened? So this is the reality right now. So from the sacred tobacco in the 1600s, the European colonialists start coming to, of course, to this country and creating American tobacco market early in the 1600s and also taking to Europe. At this point, cigars, pipes, snuff, and chew were the main tobacco products used, and created immediately a labor demand, particularly from slaves. It's in the 1800s that the European Americans discover a more convenient or more effective, efficient tobacco plant, what is called white burley tobacco. And that became a way better way to use tobacco and use it particularly in cigarette. It's still, there is a monument in honor of this kind of tobacco that supposedly was discovered and successfully cultivated by Mr. Webb. And during the Civil War, cigarettes start being disseminated as a cheaper alternative to other ways of using, mostly because of these new products that made it easier to produce them. So we get to 1900s, and I'm going to show this curve 2 times here. And what we are going to discuss now in terms of the epidemic of cigarette consumption is how we came from the 1900 where 54 cigarettes per person per year was consumed to 4,000. So what is the process on this huge rise on tobacco, or more specifically cigarette consumption? So there's many factors. So when tobacco was a cottage industries, cigarettes were like roll your own, and was expensive and had a very limited market reach. And if you see here in your left, you're going to see people manually rolling cigarettes for sale, and that was mostly, they would make maybe 4 cigarettes per hour they were able to roll. And you have the invention of the bonsai machine that would do a mass production of cigarettes. So going for 12,000, from 4 to 12,000 a minute. That was a minute actually. So this is a huge amount of more products, and these products, of course, have to be sold. The other thing that happened, and this is a recent graph, but throughout the 1900s to date, tobacco became cigarettes, and cigarettes became this perfectly rolled industrially manufactured product that not only it's perfectly symmetric, but also has a lot of changes on the product itself, from adding products to make it first more addictive, and second more like easier on the lungs and throat. So this is a very clear process that make a product that has limits in consumption, because it's so harsh, on a very easy to consume product. The other factor was marketing. I mean, I don't know if you guys had a chance to watch the Mad Men series, but it's the beginning of the marketing as we know it. And cigarettes was a very important part in this process. In the 1950s, cigarettes were marketed less as what they have in it and more being associated with values and mainstream situations and with health. And that's pretty much how marketing works. But during that moment, there was no any kind of limitation on what you can say about cigarettes. So it's a baby, it's a doctor, Santa Claus, they're all making their pitch about how important and good and clever is to use cigarettes. So this process a marketing, product development, and mass production takes cigarettes to a point that at this point in the 60s, about 0.5% of 50% of the adults, half of the population, were using tobacco. And that idea that tobacco was always lethal as it is today wasn't really the case. I mean, it became lethal over the years. The tobacco that was, of course, the sacred tobacco, but also the tobacco that was cottage industry, was really not that problematic or harmful. So we got to that point in 1960s, and then you see a sharp fall. You go from 4,000 to 1,232. Now, right now, we are around 1,000. How that happened? So a first very important factor is that what is obvious today that wasn't obvious before is that the science started documenting the harms about tobacco. Before the 60s, lung cancer was a very rare condition, was not easily to identify cases of lung cancer at all. And it became very clear with science that was done mostly 10 years before, until the publication of the Smoking and Health by the Surgeon General of the United States in 1964, that lung cancer was a big cause of death, and this was related to tobacco use, and also start documenting other tobacco related illnesses. We are now in a stage that science documents that smoking can damage pretty much every part of our bodies, and that the diseases created and the deaths attributed to tobacco are staggeringly high. So this is one factor, that is the awareness of how damaging it is, that impacts the behavior of the population. But of course, not just that. It was necessary legal actions to bring the power and the, we can say, evil intentions of the tobacco industry down. We have the Master Settlement Agreement of 1998. I don't know how much you have heard about it, but the Master Settlement Agreement was an accord that was reached in 1998. It took a good 10 years to come to this agreement, and it was between 46 attorney generals in, from 46 states, 5 U.S. territories in the District of Columbia, that made agreement with the 4 largest cigarette manufacturers in America, and they really were able to give to get billions and billions of dollars as a way to offset the damage caused by tobacco to these states. And these billions of dollars were released slowly over the years, allowing for a lot of work to be done on policy and prevention and education on tobacco use. They were able also to impose marketing and promotion of cigarettes, and require the industry to pay the selling states billions of dollars forever. We also had MSA, as we call, Master Settlement Agreement, imposing restrictions and having to agree to release public internal documents of their dealings to the public. These materials are very interesting for understanding industry tactics, and they are all stored at this point in time on a big archive, online archive, digital archive at the University of California, San Francisco. This picture on your left is a very it's a historical symbol of the how far they can go, the tobacco industry can go on lying to the public to keep their business, and is the main chiefs of tobacco industry uh, saying in front of the court, swearing in front of the court that tobacco, to the best of their knowledge, was not addictive. The other factor in this fall, from science to political action, is also that this is the beginning of having more clear public policies around tobacco. So from three areas are back then the most important. So prevent the initiation, promoting quitting, and eliminating exposure to secondhand smoking. And states get the money from Master Settlement Agreement to do that. We have more recent a fourth pillar on this public policy that is related to equity or eliminating disparities that we're gonna get to in a minute. Last but not least, in 2009, the Food, Drug and Administration incorporates to their portfolio of regulation authority tobacco products. So this is seems counterintuitive, since tobacco is the #1 killer, but that was a way to have the ability to regulate further the distribution, manufacture, and marketing of tobacco products. So you can see now a lot of negotiation in terms of imposing lower nicotine over time in tobacco products, which can take the addiction component of tobacco and discourage use. And this is possible only because FDA now regulates tobacco. So this is all about how things went. The cigarette epidemic diminished over the years, but it's not that simple. It's not that we can all go home now. The issue about equity and disparities became very clear over the years. So while we celebrate that the smoke rates have fallen to a new record low, which is a big, big victory of public health, we also have to be aware that tobacco is not an equal opportunity killer. Who were able to quit or not initiate tobacco over decades of effort of tobacco control were the people most insulated from marginalization, stigma, and inequality. And so smoking is most concentrated today in certain groups, and we'll go through them very briefly here. So first, place matters. And so you can see that in states that are more rural, in the South and the Midwest, you have a way, way higher percentage of tobacco use, particularly smoking. Uh, we can also see, and this is a King County data, that if you look at poverty and education, which are good measures for socioeconomic status, smoking is way higher in people that did not have the chance to obtain education and lives below poverty. The same thing is valid for marginalized, stigmatized populations. Race and ethnic minorities, sexual and gender minorities, military has been, and then veterans have been a big target of the industry, and been also disproportionately using tobacco and dying from it. And very clear documented now that people that suffer from mental health conditions and uh, in general behavior health challenges as substance misuse or substance use disorders and mental health issues are disproportionately affected by tobacco use. Of course, many factors go into this if we use really a model that you think about health as multi-determined and not just part of individual behavior. But I also want to point out that meanwhile, the industry really moved into preying on the most marginalized groups by identifying or like bringing identification of the values of these different groups with tobacco use. You can see that even now when COVID is happening, you have, in this case, new tobacco products being advertised with a person wearing a mask and giving for free branded merchandise from gels to masks that relates tobacco use, in this case, e-liquid products with a concern for the health of people. Last but not least, let's look at emerging tobacco products. This is a big thing given that the cigarette epidemic, although unequally distributed, is now not fading, but being added with a new wave that we haven't seen before since the 60s of very important tobacco products. They are tobacco products because the nicotine that comes in it is come from tobacco. And I'm talking here about e-cigs, e-hookahs, mods, vape pens, all these new products that can be technically called of electronic nicotine delivery systems. They deliver nicotine, not necessarily with all the components that comes in tobacco and tobacco leaves. So there is a lot of them, and they have been around in the market for 10 years now. It's interesting, and you're going to have a module just discussing with Dr. Carver the issue of vaping products, but they keep changing over time, which is typical of products that come to the market. First as disposable, then you could pre-fill your or get a refillable cartridge. Then they move to tanks or mods, so you can modify and you can buy your own liquid. And then more recently, the pod mods that took the market by the storm, and you probably heard about Juul. There's even a verb, Juuling, I'm Juuling. So right now, and this is 2018, Juul has 75% of all e-cigarette sales in the United States. So it's almost like the new thing. It's not just the product are very sleek and charming and easy to disguise. It's also they brought a new technology. Nicotine in cigarettes and also in all the different products of electronic cigarettes before Juul were developed as free-base nicotine. And what Juul brings, or mods like Juul, is a different kind of processing the nicotine that is called nicotine salts. So the nicotine salts are way, way, way easier on your throat and lungs, which allows for a very, very high level of nicotine to be delivered without feeling the harshness. So nicotine salts have a lower pH than free-base nicotine, and as I said, that's what it makes it so much easier to inhale. So what about these products? Are they evil? Are they a blessing? If we think about what we had discussed right on the beginning, that nicotine is what gives you the addiction, but is not necessarily harmful, we can say, and this is CDC saying actually, that e-cigarettes have in fact a potential to benefit adult smokers or people that already are smoking and are not pregnant if they use as a complete substitute for regular cigarettes and other smoked tobacco products. So this is very important. When first they came, there was a lot of hope around it. That's a new way of delivering nicotine that potentially doesn't kill people and people can quit cigarettes. But you probably know it hasn't happened like that in the United States. It's a little different in Europe, and I'll be happy to talk another time about it. This is not happening. The complete substitution is not even remotely a trend here. Only less than 3% of the adults that use e-cigarettes are, only 3% of the adults use e-cigarettes in 2017, probably increased. But most importantly, they are current cigarette smokers. So they are dual users. They are not using as a means of quitting. Important, so you can see in the white bars, in any age group of adult use, it's way more used by current cigarette smokers. They use both. And also very important, if you look at the 18 to 24 years old, is that electronic devices, nicotine delivery e-cigs, have been used to initiate a career on nicotine addiction. Instead of serving to quit, people are beginning their career of nicotine addiction, extremely addictive drug, with e-cigarettes. Very important too is the way these products have been being marketed to the public, and particularly Juul is like the poster child of what I'm saying here. They have been very appealing to youth. So if we look here in Washington State, 40% of youth who report e-cigs had never used any kind of cigarettes before. You can see here on your right a comparison of current use in the Washington State Health Use Survey, how this happens in 10th and 12th grades. If you look nationally, so more than 5 million of middle and high school students have been report using cigarette in the last 30 days. It's about 30% of high school students right now. So the idea that although in theory, e-cigs could help adults to completely quit, be used as a medication or a cessation tool, here in the United States, with the marketing involved, it has been not realized. Last but not least, I want to briefly talk about COVID. We are all living our lives online these days, and the discussion surrounding COVID and smoking and vaping. The main topic to discuss, of course, is on disparities, and the main question we would have in that domain is how much the intersect between COVID and smoking and vaping may increase, exacerbate the disparities in smoking and viral diseases. The jury is still out. We're going to have decades trying to understand what is happening. But I would like to point out of this just published paper where basically they are looking at people that suffer from a clearly tobacco-related disease or COPD, and looking at the proportion or the risk of developing severe COVID. And they had a really big, a large population of COVID patients. And what they found is that those that came to contract COVID and had a history of COPD were 4 times more likely to develop severe COVID, and a little lower for current smoking, so probably more associated with chronic smoking. Uh, there are many papers coming out. The science takes quite a while to develop, but in general, this is a area of research and knowledge that we all should pay attention to. I want to thank you for your time, and this is all for today.